Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, we're talking at a time when there's one word on everybody's mind, and that is the second wave of COVID-19 here in the country. So on the program today, what we've done for you is we've got all the statistics that India was facing at this time and reporting at that time during the first wave. That was around September of 2020, compared to now, which seems like pretty much the peak, or so we hope at least at this point, of the second wave of COVID-19 here in the country. So all the facts and figures, how do they stack up when we compare the current trends and the second wave trends of COVID-19 to that of the first one? All right, so let's go to the first one, and the first thing that we have for you is actually the number of absolute cases. Okay, this is the figure that you're all familiar with, but this graph actually puts in context for you that when the last time we saw a massive peak, it was 97,894. This was 17th of September that we're talking about. And now, 5th of April, we are sitting at over 1 lakh cases. This is first set of comparison. Let's look at the next one now, which will actually tell you on how soon we actually came to these numbers, right? So this is a very fascinating figure and one of the first few trends that we begin to see now. The number from 8,000 all the way to 97,000, from May to September, 109 days India took at that time to hit the first peak. Cut to the second peak over here. From 8,000, roughly that figure, to 1 lakh in almost half. 58 days alone, we have hit that peak, in fact, gone above that. So what does it tell you? That the spike that we are seeing is much faster this time around. But is it much more deadlier? That's the next graphic that we'll talk about. The number of deaths really at this point and lives lost is really what is everybody's, center point. But before that, look at this. We talked about how soon the numbers are going up. Well, look at this. The virus is spreading much faster. That means the doubling rate has actually dipped sharply. India's doubling rate, it has gone up from here in about February. It has come down at this point. So what is it telling us as well? We'll take that forward with our guests as well. Let's look at the next graphic. Deaths, right? We're looking at September, the first peak, over 1,200 deaths then. April, much more cases, but the number of deaths are significantly, or should I say, a bit lower. Remember, these are figures as of 3rd of April that we have of about 700 lives lost. This number is likely to change, remember. In a couple of days, we could actually see it going up. And like I said, not much of a difference over there. This number and this crucial thing is going to be a significant trend that will come out in the second wave. Let's look at the next graphic. India's R factor. Now, before you look into this graphic, R factor is actually the reproductive rate of the virus. That means at what intensity is it reproducing and spreading to people. It is said to be that if the R factor is below 1%, you're in a safe zone. The minute it crosses 1%, you've got trouble. All right. So in about September, our R factor, even at around the peak at that time, wasn't that large, so to say. In fact, in July is when you see a peak over here, about 1.2 touching that. And look at it now. This is the highest we have reported thus far. It's sitting at 1.32 at this point. Let's look at the next graphic now. And this is where it gets really fascinating. What we did today was try to understand which age group the virus was hitting more from first wave compared to the next wave. So the first wave is all the blue that you see, and the second wave is all the red. Now, crucial to see over here, all those age brackets where the red, that's the second wave, is higher than the first wave is in the age group, hold for it, between 18 to 30 and then also going up from 31 to 40. Look at the significant difference over here. between 18 to 30, the first wave, we were seeing much lesser younger people in the country taking a hit because of COVID-19. Cut to the second wave, many more younger people are getting infected. Also remember, younger people who are taking much longer time to recover as well. And if you look at the age bracket between 41 to 50, then 51 to 60 and 70 and all, you see a gradual dip over here, and the dip only increasing as you go towards the more elderly. So lots of fascinating details over here at this point, and we'll try and understand with our guests today how exactly do these numbers stack up and what story is it telling us at this point. How are we to assess this second wave, and more importantly, how are we to prepare ourselves better for the second wave. I'm very delighted to have Dr. Madhukar Pai back with us on the program. He is an epidemiologist of a lot of repute. He joins us from Canada over there. Thanks for joining us. Dr. Shahid Jamil is with us, virologist and CEO of DBT, back with us on the program as well. Dr. Rachna Kocheria, epidemiologist as well, with us on the program today. And also Professor Babu is with us, somebody who have of late gone to learn a lot more about how exactly the new mutant strain is behaving. All right. Dr. Madhukar Pai, my first question to you. At this point, when I talked about various parameters in which we've compared the first wave to the second wave here in the country, what for you are the most significant things that stand out and perhaps are a reason to worry?
Thank you, Sonal. Firstly, what you've shown is what we are seeing in Canada and in many, many parts of the world where there's a massive second, third, fourth wave happening. What's missing in your analysis is what proportion of the cases right now in India are variants of concern versus the older strain. In parts of Canada, 50% of the cases now are the new variants. And by summer, it is predicted that 100% of the cases will be the new variants. In other words, these new variants are extremely virulent, highly transmissible. They occur in clusters. Entire families are coming down with the infection. And it is mostly putting younger people in the hospital and the ICUs. And there is no doubt from your trajectory and what I've seen that the trajectory of this second wave in India is much steeper than what you yourself have shown. The other thing that is missing here is the testing rate in India. Because the cases went down, it is natural that a lot of health centers and facilities felt that COVID testing was no longer that big a deal and not that important. And the positivity rate, it seems to be higher right now in India, which means India is under testing compared to where it should be. So if you tested at the correct rate, you may actually see even higher numbers. And then you said this is the peak. I cannot imagine how this can be the peak. This is the upswing of the curve. There is no epidemiological, mathematical way where suddenly this curve will break and start coming towards a zero. It cannot happen, will not happen, which means we have a much rougher times ahead. And the only way I think we can get out of this mess is to mass vaccinate at a much, much higher rate than what India is currently doing.
All right. Well, what I said was we really hope this is the peak, because some of the prediction that we've been talking about, I know we're all shaking our heads to that.
It's mathematically impossible that suddenly the curve will crash down. Why? Why would it crash down, especially with large gatherings, election, Holi, all Kumbh Mela, everything is happening. Unless something dramatic is done to break the curve, it cannot break right now because it's on the upswing. And it will take time before the curve starts tapering off. So
if I were to take away, firstly, I want to say that you talked about the new variant, and in Canada, you at least know that 50% are there. In India, we are sequencing 0.1% of our positive cases. There is no way we'll ever get an idea, or anytime soon at least, about what these variants are, where all are they prevalent, and how do we manage them. We simply do not have the infrastructure for that for now. So that's one huge negative, and we've been constantly talking about it. We really hope the government is listening in. Second, what I'm also hearing from what you've said is that so far, in our trends, at least until April 5th that we're talking on, the deaths haven't exceeded the first wave, but that is likely to change, is what you are telling me right now.
It will. It will.
Dr. Shahid, your comments on this?
Well, first of all, I agree with Madhukar, what he said about variants. There are already reports that 80% of cases coming up in Punjab are the UK variant. And this is government report. 15 to 20% of cases coming from Maharashtra are the double mutant, which includes the California mutation, L452R, and also contains the E484Q mutation. In Maharashtra, it's largely E484Q and not K. As far as death is concerned, it's, I think, not the right analysis to look at death and the cases today. You know, people who are dying today were infected 2 to 3 weeks earlier.
Absolutely.
So if you did that analysis, and I just did that today, on a 7-day rolling average, we have 464 deaths today. If you went back 2 weeks to 21st of March, you had 37,000 cases. If you went back 3 weeks, you had 22,000 cases. So the death rate actually computes to somewhere between 1.2 to 2%, depending upon whether you take 2 weeks or 3 weeks. So that's the actual CFR. So to say that today the CFR is 0.5% is not really the real picture. Deaths are not as low as people are making it out to be, and it's going to go up.
Yeah, I think for the benefit of our viewers, what you're also saying is that because the spike has been so rapid, we are yet to see a fallout of a lot of patients who are already in ICUs and hospitals. So in the coming days, we'll get the real picture of how, whether or not people have managed to recover from it or not. Let me bring in Dr. Rachna Kochariya on this one. Dr. Rachna, we've been talking about this for quite some time, and if I look at basic differences between how India was behaving then, during the first wave, versus now, it is earlier, we had restrictions on travel between states. You needed a RT-PCR negative test to travel. Not there anymore. There were traffic and air traffic, non-essential air traffic almost put an end to. Not anymore. There were fines on ban on wearing, not wearing masks. Not anymore. All of these sort of stringent measures that were actually significantly responsible in containing the virus, they have gone. Are we to understand from these figures now it is time to implement it? Lockdowns alone and hotspots, shutting them alone will not work?
Thanks for having me. And to your point, I'd like to say that let me take a slightly step back, broader approach. There is a term in public health called public health surveillance or just surveillance. So I think not just a lockdown approach, a very comprehensive approach that combines, you know, the host factors, which is people, their behavior, what else we can tell them to protect themselves, to mingle or socialize responsibly, because that fatigue has set in. Virus factors, we've talked about variants, so I won't duplicate that. What's changed with the virus? So those genomics, is it spreading faster, all of that. Environment factors, what you just talked about, you know, malls, cinema theaters, we've given a false sense of comfort to the populace, to the common man, saying, yep, we've opened it all up, come on in. So, you know, rather than doing it piecemeal, and I'm sure that work is being done, but I'd like to see some more data in the public domain, public health surveillance, where this is done in a scientific manner, where the healthcare leadership, the public health leadership is actually leading, not in a reactionary manner. You know, let's react to this situation, which is bad and only going to worsen, as was said previously. But let's be watching the data, you know, from the beginning of the year, not allow complacence, see where the clusters are popping up, collate it together, translate it into action at ground level, involving communities. This is well known. This was done in previous pandemics also. And we know previous pandemics have had repeated waves. Sometimes they even plateau at a high level of infection. We have examples from other countries. Thailand has done a great job of this, you know, taking it down, right down to the community level. So I think a little shift in the thinking of the leadership, and if they're already doing it, you know, forgive my ignorance, but I haven't seen this coherent response, you know, which is not reactionary to this piece of information and that, and sort of moving forward in a actual public health. We've got some very brilliant minds in this country in public health, in microbiology, in immunology, in genomics. they all need to come together and work
and
in
well,
both
I haven't
a
seen
central
it either.
fashion
I
and a
have
local
to say,
fashion.
we're almost seeing all reactions and no sort of preparedness for a scenario like this, really. Let me bring in Professor Babu as well. Professor Babu, you and I have discussed at great length about the variant and how the new mutation, the double mutation, is something everybody needs to worry about. Forget catering to it. Government has not even said so far that this is a factor. Isn't that problematic? Also, I wanted, just to add on to what I was telling Dr. Rachna earlier, comparisons between the two waves. Now we have things which haven't changed. ICU beds full. People, 2-3 people clubbed up on one bed. That's happening again. Again, government's trying to say, well, home isolate because we simply do not have the infrastructure. And this is happening repeatedly in the same states, which is what I'll come to later. But first up, on the variant, isn't it extremely problematic that the government has not even acknowledged that all of this is thanks to the virus, which is getting creative, which is mutating, which is surviving, which is getting smarter? The same, sadly, can't be said about human behavior.
Yeah, I think that's a great question. Thank you for bringing this. So let me give my perspective on virus first. Yes, the virus mutation should be acknowledged, but so is the acknowledgement at the second wave, and so is the reason for the second wave in the, as Dr. Pike said, this is not the peak. The peak is yet to come, which means that to be very serious in terms of what actions we're taking to curb onslaught of the virus. The picture and environment is happening, there are strikes happening, and both the virus and the environment all relaxed and inappropriate COVID behavior is what it is. So therefore, a combination of all factors is only going to give more and more cases in the future, and therefore deaths in the future. What are we doing? There are saying that there are learned from the last. Where are these doctors? What proactive steps are we taking? Right now, I feel there are questions and answers.
All right, we'll fix that audio with you, Professor Babu, as well, but I'm going to slip into a very quick break. On the other side, when we come back, we'll try and understand from our panelists, then what needs to be done now? We've lost a lot of time, but is there still a way we can salvage the situation? That's coming up next. Welcome back. We are on FYI today doing a comparison of the first wave versus the second. Are there any lessons to be learned from here, and what are the trends telling us? Let me go back to Dr. Madhukar, Professor Madhukar Pai at this point. I wanted to understand from you that when it comes to the areas which are seeing the maximum impact, and I'll request my producers to put those graphics back up as well, we analyze the states which had the maximum impact in the first wave and the states that are seeing the maximum impact in the second. What you see over there is more or less, they are the same states. States like Maharashtra, Tamil Nadu, Karnataka, Andhra Pradesh, Delhi, Uttar Pradesh in certain cases as well. This is wave 1. Let's go to wave 2. And you see pretty much the same states again. Why is that happening, Professor Pai?
So firstly, this analysis doesn't quite tell me whether other states are simply not looking for the virus. I think places like Maharashtra clearly were testing aggressively, and they're probably still testing. So this could well be, some of it could well be an artifact of the testing intensity. The second thing that worries me, if this is true, this is a real trend, then just think about it for a second. If Maharashtra, for example, was really, really hit hard last year, and presumably the virus went through the population at a very high rate, presumably many people in Maharashtra got exposed to the virus and recovered from it.
Positivity. There should have been antibodies.
Exactly.
Yeah.
So if they are coming down at this rate this time, there is no phenomenon on earth that can explain this, except that the current virus is very different from the previous virus. There is simply no other easy way to explain how, despite such a widespread outbreak in Maharashtra. They're seeing this many cases. That means this new strain probably is very different, very virulent, and the previous virus episode is not conferring sufficient immunity for people to prevent from getting reinfected. So I would also love to know how much vaccination Maharashtra has done and whether the existing vaccines will work equally well against the current virus strains compared to what we designed it for last year.
All important questions, all questions and data points that we've been looking for and we haven't found. So really don't know how we are ever going to establish this. Dr. Jamil over here, then talk to me about the availability of the fact that, what about reinfections now? Are people who had antibodies which have faded away, or people who've even got their vaccines, how are they to deal with the current load and perhaps the wave?
Well, if you look at Maharashtra, let's focus on Maharashtra. The numbers that are coming from Maharashtra, while I do agree with Madhukar that mutants are going to be playing a big role in this, and my information is that the government is trying to correlate epidemiologically the mutations that are being seen, whether they are involved in the surge. And, you know, I honestly believe, like he does, that eventually it will turn out that the virus that we're looking at is a very different virus. The second factor that you have to take in is that in the first wave, a lot of people in the poorer areas of Maharashtra, especially in Mumbai, got infected. The ones that are coming up with infection now are people who are in middle class, upper middle class, upmarket areas. That population still was, had only about, and Giridhar will possibly have to say more about it. That population only had about 15%, maybe 20% antibodies. So there are still a lot of susceptible people out there who are getting infected. Also, there are certain districts in Maharashtra, districts like Amravati, Yavatmal, Akola, parts of Nagpur.
And can I also add, in the second wave, we actually saw tier 2 and tier 1 cities getting more infected. Their reproductive factor and the R factor and the positivity rate has actually gone up compared to the first time around. So clearly new places that the virus is spreading as well. But last comments really, and if I can go back to Professor Pai over there, on this age factor, what really struck with me when it came to the age brackets is that how younger people are getting it much, much more. I'm hearing it from doctors on the ground as well. So then the fact, I mean, we have to open it up for the young, don't we, right now?
I mean, that is the scariest part here in Canada, in the US, in Europe. 30, 40, 50-year-olds are now in ICUs and on ventilators, which means the vaccination currently here is still reaching people in the 60 above category. It's countries like the United States, UK that have pretty much dropped it to cover the younger populations, and they are reaching 30, 50, 60% of their population has now gotten at least one dose. Okay. Israel, of course. And those are the countries that have done extremely well on the vaccination front. Canada is at 15% of the population. India is around 5% of the population. It is simply not adequate right now.
Not adequate at all, not in terms of testing, not in terms of sequencing as well. I'm completely out of time to leave it there for the moment. But thank you all for joining us on this very important discussion. We'll keep a very close eye on this for tomorrow's episode as well. See you then.